Hi, everyone. It is my honor to welcome you to the 2017 Healthcare Innovation Summit. We are so excited to have you here today. For those of you who have never been to this program before, I wanted to tell you a little bit about Stanford Medicine X. We are a program that focuses on the intersection of people, technology, and design. Each year, we convene this summit to solve big problems in healthcare, and there has never been a greater need or a greater opportunity to do that than right now. Now, at Medicine X, we always start with stories, and to that end, I wanted to tell you a story of my own experience. It was 2012, and I was the top performer in my sales team, bringing in new enterprise clients, beating my quota by 157%. But secretly, I was an employee struggling to navigate the healthcare system. I notified my employer that I needed to go on medical leave to have surgery. And a month before I had my surgery scheduled, I was notified that I had been let go. Now, this is not a good experience, and I was a little bit shocked at the time. So I did what any unemployed, logical millennial would do at the time. I started a blog. And the first post, the first paragraph of my first blog went like this: how did my employer even think about what would happen to me if I couldn't pay for my surgery? Now, luckily, I had a safety net. I was married at the time, so I was able to get the care that I needed through my husband's insurance. However, many of us don't have that safety net. Many of us are not that lucky. So the questions that we're going to ask today are all focused around how we make employee and employer benefits a better experience. We have to ask ourselves, how is it okay that the only time it's safe to get sick is when you're employed or you're married? Something about that has to change. So I ask, does one employee voice really matter? Well, we could all argue that at some point or another, most of us in this room are employees or have been employed at some point. I would also say that we're hired to be the best and the brightest on behalf of our employers to bring in the revenue and save costs. But there's an elephant in the room. I don't know if you noticed it when you walked in, and if you didn't see it, I want to paint a picture for you. That elephant is that behind the line between professional and personal, we're human. We get sick. We're vulnerable. And we need to be able to address that in a way that merges those identities. So we're very excited to have everybody in this room today because we have a $3 trillion industry where some stakeholders are adding value, some are not, and everybody wants a piece of that big pie. We want to create a different kind of pie. Many of you in this room are employers, and we are so excited to see you today. You are here because you care. For the first time, Medicine X has brought you in as stakeholders because we know that this is a missing piece of the conversation as we drive demand for healthcare services. Many of you are patients and caregivers. You are the experts navigating the healthcare system, and we want to lift your voices and have your perspectives heard. We have some of the best and brightest minds here at Stanford and at Silicon Valley as well, coming to this event today. And so what I want to convey to you is that we are not passive people that just let the system happen to us. You, every single person in this room, has a voice in this conversation, and you have value. If you don't believe that you can take what you learned today and go back to change things, I want to share one final story before I bring Bassam up. I was a person in the audience a year after that, and I didn't believe that I had a voice in the healthcare system. This program empowered me to see how I fit into a bigger picture and to make change that I needed around me. And I hope that you will be able to do this with this conversation about employee health benefits today. Thank you.